minutes time just to let people know.
Yep, good to go.
Okay, great. Okay, welcome to the webinar, the weekly PHEOC webinars. So my name's Emily Collard from Public Health England, and I'll be moderating today's panel, joined today by our presenters, Dr. Mary Stephen from WHO Afro and Dr. Raymond Hamunga from the Zambia National Public Health Institute. I'm also joined by our panelists, Ariane Harm from Robert Koch Institute and Catherine Clodfelter from US CDC. So thank you all for joining us for the 31st webinar of our weekly webinar series, and welcome to the second webinar in this series on learning lessons from public health emergencies. So thank you all for rejoining us after last week's webinar, and we look forward to continuing this engagement with everyone through these webinars. So just a quick update to say that unfortunately there's no French translation service available today. So hopefully that will be resolved and we can have that back again next week. You can submit your question about the webinar, and what we did last week was really try and encourage people to share their experiences, because lessons learned and lessons identified is such a broad subject, and everybody's engagement with the process is different. So we're really encouraging people to share their experiences. So if you don't necessarily have a question, but you have a comment or an experience that you would like people to know about your engagement with that process, then please do put it in the chat box or in the question and answer part of the button at the bottom of your screen. So I would just encourage people to do that throughout the presentations so that we can discuss at the end. So if you've not already done so, we'd also encourage you to join the PHEOC Communities of Practice, which is on the Discord platform, for continuous engagement with experts and professional colleagues through the link that will be posted in the chat box shortly. We also have, you'll see towards the end of the webinar, a pop-up poll for you to fill in. Your feedback's really important to us and helps us continue to improve these sessions as we go forward. So please do encourage people to fill that in. So as I said, today's session is the second webinar in the series on learning lessons from public health emergencies. Last week, we looked at the lessons learned process and why it's important in the context of public health emergencies. And the rest of the series, including today's one, is going to be looking at how we capture those lessons and what guidance or toolkits, etc., is available to support that process. We're hearing a little bit about the country experiences in delivering interaction reviews for COVID specifically, and what the good practice and challenges are. And then also part of this series is looking at the importance of action planning and monitoring the progress and implementation of turning those lessons that you're identifying into action. So the topic of today's session is about capturing lessons and focusing on the COVID-19 interaction review process. We'll first hear from Dr. Mary Stephen, who will take us through the interaction review process in more detail, followed by Dr. Raymond Hamunga, who is going to talk about the Zambia country experience of delivering an IAR. So Dr. Mary Stephen works with the Health Emergency Preparedness and Response Team at WHO Afro in Brazzaville. She coordinates the regional office work on international health regulations. And for the COVID response, Mary has been involved in the IHR Points of Entry sub-pillar lead and coordinates the work on international travel and trade, interaction reviews and points of entry. So I'll hand over to Dr. Mary now to do her presentation.
Thank you, Emily, and Happy New Year to all. So let me quickly share my screen. Can you confirm that you can see my screen, please, Emily?
Yes, we can.
Okay. Okay, so thanks and welcome once again. For the PHEOC group, I believe the interaction review is not new to you because most of the countries in Africa have conducted after action reviews before, which we will see that is actually similar to the interaction reviews. So why are we talking about interaction review? Where does it come from? So following the 4th emergency committee meeting for COVID-19, which took place in July 2020, there was a recommendation to WHO Secretariat and to countries to conduct interaction reviews for the COVID-19 response, to document lessons learned, share the lesson, and also use the lessons to improve the ongoing COVID response. So this was the mandate given and recommendation to member states for the COVID during the 4th emergency committee meeting. So following that meeting, WHO developed a guidance document to support countries with the conduct of their interaction review. In Africa, the first country that conducted the interaction review is actually South Africa. And then we have many more countries. We have close to 20 now that have conducted interaction reviews. Feel free after the presentation by Dr. Raymond, if you want to share the experience from your country as well. So why are we doing the interaction review? We have been in this outbreak response for a year now. So it has been a protracted crisis and the outbreak is still ongoing. So it is always good to sit back, look at where we are coming from, where we are, and where we want to go. So we look at the lessons we have learned, especially for a COVID-19 outbreak that is new. So things keep evolving all the time, and we have to learn the lessons and we adjust our response as much as possible to adapt to the evolving situation. So like I said earlier, the interaction review was adapted from after action reviews, which is a qualitative review of actions, and I believe most countries in Africa have conducted after action review. So basically the main difference is the fact that after action review, we conduct it at the end of an outbreak. The interaction review, we conduct it within the response, but most of the principles are the same. So what exactly is this interaction review? It's a qualitative review of actions. So to simplify, it's reviewing our response, looking at the strengths and the weaknesses, the lessons we have learned, with a goal of improving the ongoing response. So it's a space for collective learning where we bring all relevant stakeholders to critically and systematically analyze the actions that we have taken during the response and develop recommendations for improving the ongoing response. So what interaction review is not, it is not an external evaluation or evaluation of a team performance. It's also not an opportunity to blame or criticize individuals. So basically we are looking at the system, not an individual. For instance, if I am the director of surveillance, if something is wrong in surveillance, it's not me, it's the system. So we look at how we want to improve the surveillance system. So the purpose of the interaction review, like we said earlier, is to share experiences and to build consensus and come up with lessons that we have learned in a given response. And in this situation, the COVID response, to document these lessons, we can share the lessons for peer learning We can also use the lessons to validate and update our response. We can use it to readjust our response as well. So the principles is usually a participative process with an open spirit. So we say it the way it is because we are not looking at individuals, but we are looking at how we want to improve the system. But not just looking at the challenges, also some of the good lessons we have learned, we can share, document them, share with countries so they can also learn from our experiences. So one of the initial things that we need to do when we are planning for interaction review is to look at the scope, because this will be one of the factors that will determine the success. So the period under review, are we reviewing right from when we started readiness or from the day we had the first COVID case? So we have to define that and make it very, very clear. Then we discuss the pillars we want to review. Do we want to review all the response pillars, or we want to review a single pillar of the response? Then looking at it, is it national or subnational level review do we want to do, or we want to do a combination of both? Then with the COVID situation, whether it is face-to-face or we want to do it virtually. The number of days depends on the scope. Whether we want to do it, we want to look at a single pillar or the entire COVID-19 response pillars. So it ranges from 0.5 to 2 days, but we have seen countries reviewing over 4 days. But like I said, it depends on the scope, how far we want to go. And part of the scope, we also need to determine the participants. Their profile is important because what we need is people that have been involved in the response. So we need to agree on that before we get into the process. So some of the pillars, this is an example of the COVID-19 response pillars, but we can add and subtract depending on our needs. We can also look at cross-cutting issues, as you can see in number 10, that we think needs an in-depth review. So like I said earlier, we can do either national or subnational or a combination of both. What we have seen in Africa, most of the countries are doing national and subnational reviews because some of them, they try to review some of those districts or LGS where the COVID-19 cases were first reported because they wanted to understand the response. But it depends on the country. It's a continuous process of learning. It's not a one-off thing. So once we finish this review, at the end of the COVID-19 outbreak, when the outbreak is declared over, then we conduct the after-action review. Okay, so some of the possible reasons why we need to conduct the interaction review, the situations, maybe there is increase or decrease in number of cases. We want to review specific COVID program. We want to review, for instance, national supply chain, because logistics has been such a big issue in this COVID response, or whether there is a demand from the civil society organization. We want to look at the impact of COVID on the economies and other aspects of life, or we want to look at areas that need research or some further topics of concern that we want to review in depth, or even readjusting public health and social measures. So the roadmap for interaction review, we start from the pre-IAR, then the IAR itself and post-IAR. So from the preparatory stage, like we said, we have to define our scope. We develop the concept notes, we establish the IAR team, have our budget, the agendas as already participants agreed upon, and we agree how we want to do it. National, subnational, online, or virtual or face-to-face, or a combination of both. Then we need to look at the relevant documents. Looking at the guidance document is available on the WHO website to review, especially for the facilitators. And then we have what we call trigger questions. The facilitators need to review the trigger questions ahead of time so they can agree on what the kind of question they want to use based on the scope and what they want out of the review process. Then during the process, we have steps that we follow for the interaction review. So in a very systematic way that takes us to reviewing the challenges, the best practices, and coming up with recommendations on how we can improve the ongoing response. The most important part for me is the follow-up after the interaction review. We need to have a team that will follow up on the recommendations so that they are implemented, because this is an ongoing process and we need to implement it so we can improve our response. Okay, so what makes the interaction review successful? When we have, like we said earlier, a well-defined scope so that somebody will not come at the last minute or on the day of the review trying to readjust or add some things. So we agree on this ahead of time before the date of the review. It is a country-led process, and so government needs to take ownership of the process. So we need to come up with a recommendation that is mutually agreed upon by all stakeholders. And because of that, we can use the findings we have to readjust our plans and also to improve the ongoing response. We focus also on system thinking. Like we said earlier, it's not an individual thing, but also it's a system we are looking at. Then we said it's a continuous process of learning. So it's not a one-off event. So some of the proposed outputs that we can get, like we said earlier, document lessons, we can update our national response plan, we can readjust our public health and social measures, we can use it to readapt the response itself, taking into account evolving situation. It can be a peer learning, we can publish the lessons from a given country for other countries to learn from, and they can adapt and implement such best practices in their own response as well. And overall, we can use the finding to support preparedness and response to other emergencies. As you all know, in Africa, COVID is not the only outbreak we are dealing with currently. We have so many outbreaks concurrently the countries are responding to together with the COVID. So this is a saying from Winston Churchill: never let a good crisis go to waste. No matter the challenge in the response, there is always something good we have learned. And in the process of COVID, there were quite a lot of innovations that came up from countries in Africa. So we should have this system of reviewing, documenting, and sharing that countries can also learn from the experiences that other countries have come up with. So we have majorly 3 steps, but we start with the introductory bit of the response. We look at the response plan and look at the actual timeline of the response. So looking at the response plan, what did we set out to do and what have we done? So we look at it and then the timeline of our response. After that, then we go into reviewing step by step what went well, what went less well, and why. So this is the best practices and the challenges and the reason why it happens. So we look at the strengths, challenges, the contributing factors. So in the process, at this stage, we do a root cause analysis, asking why, until we get to the root cause of the problem. And for every challenge, we have to identify what the limiting factors are and the impact on the response. And for every best practice, we identify what the enabling factors are and the positive impact on the response. Like I said earlier, we have a package of IAR tools, and among these packages, you will find the trigger questions. So with these trigger questions, at this stage, the facilitators will use the trigger questions. So they would have identified the specific trigger questions they want to use to guide the discussion. So I've explained the remaining bit of it. So we try as much as possible not to have a shopping list. So we limit to key challenges and key best practices. So this is just an example that you will go through and show your participants when you're conducting the interaction review, so they are aware of what is expected of them from every session. So we are learning lessons, documenting best practices, but we should always remember that for every given response, we also develop new capacities. One very good example for the COVID response, the capacity for laboratory testing, for instance. We started with no capacity in Africa, and then most countries have established and expanded the capacity for testing. And there are so many new capacities countries have developed. So we need to document those as well. Okay, the next step is to look at what we can do to improve the response. So this is basically the step where we come up with activities to either institutionalize the best practices or address the challenges. And for each activity, we need to have a timeline for implementation and who is responsible, and some indicators that would show that these activities have been implemented when we are reviewing it. So it needs to be practical, the activities, and not all, we don't have to develop like one activity per one best practice or one challenge. We can actually have a collection of challenges that are similar and maybe have one activity to address them. So it's very flexible and adaptable. The last session is the way forward. So the way forward, we discussed, like I said earlier from the beginning, that the most important thing is follow-up. So we establish what we call the IAR follow-up team, and there has to be a lead that will follow up on the implementation of the recommended actions and also document the process of implementing these recommendations. We need to engage the senior management. If, for instance, we have done interaction reviews for COVID-19, looking at all the response pillars, the minister needs to know the findings, what needs to be addressed, everyone, DGs in health, so it doesn't stay with us. So they get involved in the process, and we need to go back and give them the feedback on the process of follow-up for implementation of this recommended action. Ideally, if we do this thing correctly, it should take us a step further from where we were when we did the review. So we would have addressed some of those challenges identified. We continue to learn the lesson. After some time, we do another review to see where we are, what we need to readjust. So we said it's a space for continuous learning. For the PHEOC, usually you can review it as a separate entity, or you review it as part of the first pillar, the coordination and leadership. So it depends on you, the peculiarities in your countries as well. So we have tools for interaction reviews. They are available in all the 6 WHO languages and Portuguese. So they are on the WHO website, as you can see on this slide. It will be shared with you. You can just go there. You will find everything. There is template for concept note, facilitators manual, you have generic agenda, presentation, the trigger questions, the note-taking template, the reporting template, participants' feedback. So you have everything, and the success story template as well. So you can download it, look at it ahead of time before the IAR process. The success story template is available for countries to document best practice and share. So if you want to share with other countries globally, you can use this template document and send to us. It will be published on the website where other people can access and learn from your experiences, and then they can contact you for further guidance if they want to implement the same thing you have done. So it's available for all countries to use. Summary of interaction reviews. I'll pause here and take your questions. Thank you.
Great. Thank you, Dr. Mary. Really, really great presentation there on interaction reviews. So Dr. Mary's talked about the importance of that interaction review scope, and I think that links very much back to some of the discussions we had last week around getting that agreement and also with your sort of senior level buy-in and leadership, and also the ability to have it as scalable as you need it to be. So whether it's as Dr. Mary mentioned, single pillar, multiple pillars, it might be a good idea to start small and then get bigger as you do more of these interaction reviews. We talked a little bit about the process and how pre-planning is key, and a little bit about the benefits of documenting the lessons and sharing the best practice. And then the importance of working through those toolkits that are available. We've put the link in the chat box there to the IAR WHO webpage, and using those to kind of just support your interaction review process. So really also drilling down into the why like that bit, and using the trigger questions to help steer those discussions, and some useful detail there on the simple sort of step-by-step process for the interaction review. And I hadn't seen before, actually, Dr. Mary, that success story template. So that's a really good addition to that, and really focuses on that sharing the lessons and sharing the learning and the good practice that people are absolutely doing for COVID response. So that's a really good thing to have. I think we haven't had too many comments in the chat. Does it look? We've got a couple of questions. Catherine, I don't know if you're able, or Ariane, is there anything you wanted to add, or do we need to go through anything specifically?
I think there were a couple of interesting questions. So there's one in the Q&A where, first of all, of course, the person thanks Mary for the wonderful presentation, and then asks if she could say more about the roles and responsibilities of EOCs in the interaction review process.
Okay, that's a great question, really. So in most countries, the EOC helps to coordinate the process of the interaction review, but it will also depend on the peculiarities of the country, how they coordinate. But most times the coordinating role the EOC plays right from the planning phase to the follow-up. So, but different countries have some mechanism, so they need to reach out to the national authorities and see what role they can play, but mainly the coordination from planning to conduct and follow-up. And like I said earlier, the PHEOC can be reviewed under the first pillar, leadership and coordination, or you can put it separate.
And I'll follow up with an additional question that I think we've received. Thank you so much, Dr. Mary. The question is about timing. And the question is specifically, how do you align recommendations from the IAR with existing development plans? And can you talk a little bit about when to do an interaction review within that? Thank you.
Okay. It's very important, especially if maybe your strategic response plan for COVID is about ending, the timing, if I'm sitting in a country, for instance, our strategic plan, let's say it's ending in April 2021, it will be much more beneficial for the country to conduct interaction review, let's say in February or in January, so we can identify all the key issues and incorporate it into the plan. If you develop or if you conduct the interaction review after the plan has been developed, already you have missed an opportunity to incorporate the findings from the interaction review into your plan, where it can be systematically implemented already. So you will use it to adjust some of your response strategies. So, but if, for instance, you want to do the review, your plan is still running, you can still do it, but you have to find a way of making sure that the recommendations are implemented while the plan is still ongoing. But I wouldn't tell you this is the specific time. Like I said, since July to review, and it's not a one-off event, it's a continuous process. So basically what we do every 3 months, you try to look at what you have done, try to review. It doesn't have to be really very big. Depends. If there are issues you want to address, you can just take like a day and look at the specific pillars you want to, especially now that most countries have done the first one already. So subsequently, they may want to focus on some specific issues of interest.
Great, thank you. I think we've got one last question in the question and answer. So which section or pillar is in charge of conducting the IAR and following up on the implementation of the recommendations?
Okay, so I think this relates to the initial question we have answered. It depends on the structure in the country. But like I said, if you want to coordinate the interaction review, the coordination pillar, leadership and coordination, in most countries is the pillar that is responsible for coordinating the planning, but everyone is engaged at the planning process. So you agree together on the scope and how you want to run it, national, subnational, offline, online, together with everyone, but there has to be someone coordinating. And in some countries, the PHEOC coordinate, and some they coordinate it from the Department of Health under the DG. So it depends on the peculiarities in a given country. And for us, once you are ready, if you let us know, we support, we can help look at the concept note and everything. We also do facilitators training. So before the date of the IAR, once the facilitators are they are identified, we do a training for them and do the document. So for every pillar, I didn't go into details because those details we cover them in the facilitators training. For every pillar, you're supposed to have a facilitator and a note taker, at least one, where you may have two, a facilitator, co-facilitator, and two note takers. So we take this group of people to the facilitators training. We go in depth on how to go step by step with the interaction review. So they are conversant because they are going to take their team through the same process as well. So they need to understand it. Over to you.
Great, thank you, Dr. Mary. That's some really good answers to the questions there, and we'll move on to the next part of the presentation. I will try and share Dr. Raymond's presentation in one moment, unless the Secretariat can share the presentation. Dr. Raymond is going to take us through the Zambia National Public Health Institute experience of an IAR. Dr. Raymond is a veterinary epidemiologist based at ZMPHI in Zambia and holds a bachelor's degree from the University of Zambia School of Veterinary Medicine and a master's degree in epidemiology from Massey University, New Zealand. Dr. Hamunga serves as the managing editor for ZMPHI's Public Health Bulletin, the Health Press, under the Communication Information and Research Cluster. The ZMPHI is the Disease Intelligence Wing of the Zambian Ministry of Health, responsible for disease surveillance and emergent events. For Zambia's COVID-19 response, Dr. Hamunga serves as the Planning Section Chief of the COVID-19 Incident Management System. So over to you. I will try and share your presentation. One moment. Can people see that presentation in presentation mode?
Yes, we can.
Yes, thank you very much, Emily.
Great. Just tell me when you want next slide, Raymond.
Great. All right, now we can move to the next slide, please. So thank you again once more for having me on the panel today, and also thank you for putting this together and allowing us as Zambia to share our country experience with actioning and interaction review. What you have up there on the slide is our interaction review report, and public. Could I please have the next slide?
I think we're struggling a bit with sound, Dr. Raymond, so I don't know if you want to turn off your video just in case that's affecting the connection.
Okay. Are you able to hear me all right?
Yes, I can hear you now. It's better.
Hello, Emily. Are you able to hear me all right?
Yes, I can hear. We can hear you.
I seem to have lost sound from your end. Can you hear me?
We can hear you. Can you hear us?
Yes, I can hear you now. Apologies for that. I was just switching between headsets.
No problem.
Okay.
Am I on the right slide?
Could I? Okay, yes. Is how my presentation outlined the challenges that we encountered and the next steps for us. Okay, we can have the next slide now. So for us as Zambia, I think what sort of necessitated us holding an interaction review was around the rapidly evolving pandemic of COVID-19. We thought it would be better for us to review our functional capacity of the public health emergency response at both national and subnational levels. So as earlier alluded to by Mary, ours was both a national and subnational interaction review process. And we sought to do that to identify the areas that need immediate remediation and also to target those things that we thought we were doing right in the response. Next slide, please. And for the COVID-19 response in Zambia, we are responding through what we call an incident management system. A good number of you could be familiar with what an IMS is. And this is just a multisectoral way to responding to public health incursions. And as you can see, the IMS structure serves as the as the key technical arm of the response, and this feeds into the policy-making decision arm of government for the response. And the IMS, of course, comprises and sits under the Emergency Preparedness and Response Cluster of the Zambian National Public Health Institute. And with that, we have a PHEOC manager, and we have appointed an incident commander, an infectious disease specialist, who provides the overall guidance and various sections. We have the operation in the slide, the laboratory, the surveillance, and so on and so forth. We do have a planning section, which I'm privileged to head. And under that, we do have the various units tasked with CTREP reporting and scientific advisory committees. And we have a logistics section, as well as a financial and administration section. So this is how, as Zambia, we've responded to COVID-19. And closely related to that, all our cooperating partners are encouraged to belong to either of the many various units under those various sections to contribute and bring their expertise on board. And what we agree collectively is what we report to the policymakers and push for it to be implemented into law or part of the revised response. So next slide, please. So coming to the objective of our IMS, what we targeted or envisioned was that we need to share experiences of the response thus far and analyze the COVID-19 response in Zambia thus far and see what are some of the challenges and best practices that we can sustain. We also aimed at facilitating consensus building amongst the various stakeholders involved in the response. As I've already outlined, we have various cooperating partners and various non-governmental organizations that are involved in the response. And sometimes many partners would want to do things differently. Many organizations have different, and therefore, because of these various differences, we wanted to have one way and unified way to avoid duplicating of efforts and ensure that we all stay on the same page. And also wanted to document and apply the lessons that we had learned up to then, and also provide a basis for updating and validating the country's COVID strategic preparedness and response plan accordingly. So let me talk about what went well. The next slide. So for Zambia, this was a very much country-led process and also a multisectoral in nature. And by that, we had a good technical support from the WHO and also other strategic partners. And our approach to it was to come up with a small team, which primarily consisted of section unit. COCO team met and we looked at the tools that were provided by WHO, and we were able to identify which of the trigger questions were relevant and were context specific to Zambia. The tool is quite big, is quite comprehensive, and it is imperative that every country that intends to undertake a country level interaction review adapts that tool to ensure that it speaks to their needs. So we met as a small team for about 2 weeks prior to the actual interaction review, reviewing the tools, priming those who will be facilitators, running them through the trigger questions so that they are very much comfortable with the process before we could have a bigger team meeting. We also had a good buy-in from the stakeholders arising from the weekly IMS meeting that I've just highlighted in the previous slides. We talked about the interaction review, what we were hoping to achieve, and what their role would be. And based on that preparation, we were able again to identify who would be able to sit in the meeting, whether they'll be in person or they'll attend virtually. And importantly, we do have a national contingency plan that speaks to the whole response, the whole of government response to COVID-19 pandemic. And therefore, the interaction review was meant to align our findings to that whole of government response. And by making it multisectoral, it was possible for us now to know that if we put in the plan that we expect the ministries of education, for instance, to do A, B, C, D, they were already on board. What we expected the ministries of local government, for instance, to do was already described the national contingency. Of course, with everything that goes, there are always challenges to reach, and I'd like to get into the challenges now. The next slide. So obviously, this was the first time we were conducting an intra-action review. We are accustomed to conducting after-action reviews, and it was the first time we were doing that. And with everything that you do for the first time, there are always challenges and there are always learning curves, good, positives, and the negatives, as well as also the novelty of the pandemic. For a long time, we did not have information about what are the specific rules around COVID-19 response, and we had to change our messaging systems. For instance, the risk communication and community engagement cluster, they had various versions of literature around masking, social distancing, and they had to continually adapt this and ensure that even in the intra-action review, what they are recommending can be things that are not only able to stand the test of time, but can be quickly adapted to change at the emergence of any new scientific literature in the response. And again, like I said earlier on, physical distancing in this time is quite tricky to get a big number of people into one room, and therefore not everyone could be available in the room. We had to do this partly virtually, and with a few core team members and representatives present in the room. And one thing that we did for us to enable and make that easier is that
I think we have lost Dr. Raymond.
we ran this meeting over the course of 4 pillar met, and 1 or 2 are too known, and we had a total of 9 pillars meeting. Okay. Apologies, I think I had dropped off. So one challenge that we had again was the subnational level review not being quite as comprehensive as we had envisioned it to be. And this was primarily due to them not being able to be in the room with us, and we did have connectivity challenges, and that was one of the challenges that we had. And our resources will always be constraining in most cases. We had not really, from the word go, planned to have an intra-action review, and we had not budgeted that in our pandemic and EPR plans. And so we didn't have readily available resources to quickly align some of the immediate and mid-term recommendations that came out of the intra-action review. Next slide, please. So if we are to make any recommendations to someone who's about to get into an intra-action review, our first and foremost recommendation is that do it. Just get into it and do your intra-action review. It's a process that's very helpful. It opens up, it brings synergies, it breaks barriers and bureaucracies, and it brings everybody on the same plate. And secondly, as much as is possible, you need to make this a country-led. You need to take leadership for it. And then thirdly, get high-level buy-in and support. And by high level, we refer to your permanent secretaries, your ministries, ministers of health or secretaries of health in your respect, and what it aims to achieve. We were able to leverage on available technical support. Again, make that a priority. So many people have done intra-action reviews, and the WHO has quite a number of resource persons who can guide you through how to do these things. And I think the previous speaker did also outline where you can get these resources. And as much as possible, make it multi-sectoral in nature. widely consultative, so that as you escalate it to a higher policy level, you do not meet any hurdles or hardships or even opposition to the plan. And then also you need to build on the best practices you identify. If something has been identified as working very well, as much as possible, actualize that into policy. Next slide, please. So for us now, in terms of the next steps, we've submitted the report to the policymakers, and the Ministry of Health, through a permanent office of the Permanent Secretary and the Minister of Health, they've endorsed the multisectoral interaction review that we developed, and it's been sent back to us as technical people for us to implement. And in that regard, we do have now a smaller team again of multisectoral in nature and various stakeholders who are developing the next step strategies on how we can actualize some of the things that we came out of the interaction review. So we're going to implement the mid and short-term best practices. And also, like I said, we've aligned the interaction review to the national contingency plan. So we did have a meeting where the Office of the Disaster Management and Mitigation Unit, which is the lead under the interaction review and of government plan. And also, we're learning lessons from both the good and the bad. And if we are to do another interaction review, it is a definite yes, depending on the evolving of the outbreak. We are now undergoing a second wave of COVID-19 cases in the country, and things are not as they were when we planned our interaction review. But we need to look at surge capacity, how best can we align it to the second wave, and for how long are we likely to have this second wave of COVID-19 cases in the country. And therefore, another interaction review is not out of the question. Thank you once more, Emily, for having me, and I'll hand it back to you for any further questions and guidance. Thank you.
Excellent. Thank you so much, Raymond. Some really good points there, and thank you so much for sharing your experience of doing the interaction review. I'd be really keen to find out if other countries have had similar or different experiences with the IAR process. And if you're happy to share, then please share any of the experiences you've had in the chat box. If we can't get round to reading them out today, then we will we intend to pull them all together into a document if people are happy for them to be shared, and then we'll post that on Discord platform along with all the presentations. So Raymond there really covered, really reiterating the points that Dr. Mary made about the IAR process, and sort of talking about it being based on their incident management system and the structure, and sort of it's about sharing the experiences and analysing that response to make, and really getting a unified way forward and agreed. Talking about the toolkit being very comprehensive, but the importance of adapting all of those for at the country level, and also the importance of pulling together a planning group. Dr. Mary spoke a bit about the importance of pre-planning as well for the IAR. And I think that's a really key, important aspect of this, to ensure that you get the best out of your workshops and your IAR, so that you can get the best from people. So the key is in the pre-planning. Also identifying facilitators early on, so that you can they can be prepared, and again, that's all part of making sure you get the best out of it, and aligning with any sort of relevant contingency plans. Some really important and useful to know about the challenges that Zambia had in the delivery of the IAR, and some sort of common ones, and probably challenges that a lot of people will be familiar with there, particularly around connectivity and resources and things like that. And then some useful recommendations and what the next steps are. So I was because I was sharing the presentation. Catherine and Ariane, have we got any any questions?
Not yet any questions to this country presentation, which of course provides an example for everything that was presented earlier. There was one question from earlier that we haven't addressed. Maybe I'll read it out now. And that was somebody asking whether Mary or Raymond could share ideas or recommendations for conducting interaction reviews in online settings, as currently many stakeholders will not be able to travel on site during the response. So if any thoughts on that might be interesting for the participants. Thank you.
Yes, thank you very much. For most countries, they use both online and face-to-face. So, like we heard from Dr. Raymond, to do both a combination of virtual and face-to-face interaction review. But all processes have their ups and downs, the pros and cons. If you have most of your participants virtual, for instance, sometimes you could have technical issues with internet. Except if you're in a country where internet is very good, then it will be easy for you to do it that way. And these technicalities with the internet connection most times happens with the locations in the remote areas, the districts where you want to connect some people. You may have issues with the internet. The face-to-face, you cannot put so many people in a room. So you have to limit the number and make sure that you're observing the physical distancing measures in the room. So both ways, but most of the countries that have conducted interaction reviews in Africa have used both mechanisms, virtual and face-to-face. So they have some of their participants sitting right there in the room, and then some of the participants are actually connected virtually, because we have the functionality on Zoom where you can put people in groups. So the virtual participants can be shared into the different groups as well, and they can participate in the discussion. But just to note that if you're doing it virtually, test the internet ahead of time first, so you don't get surprises on the day of the reviews. So these are some of the issues, but really it's up to the countries. It's very flexible and adaptable. So you just look at your context, what works best for you. And there is this question we usually get: should I do it? Should I start from subnational or national level? So this also depends on the peculiarities, but they all have their advantages and disadvantages. Like if for instance, you start with national, then the subnational people, if you want to do subnational, we use the opportunity to learn from the process, and they can replicate it under the guidance of the national experts. If you start from subnational level, it means that you have to send the national expert to that level to help them too, and then you can use the finding and bring it to the national level. So both ways is adaptable, just contextualize it. And I saw one question from Gambia on how they can be supported. You can just send us an email and we can take you through the process, including doing facilitators briefing for you, and then you can run the process. And where there are issues, sometimes we also connect virtually, or to give like an additional facilitator that could quickly guide where there are issues when they have challenges. So maybe you can share my email with them if they are.
Thank you, Dr. Mary. I think we've had a couple of other questions similarly on that subject of sort of what the challenges are. And I think the virtual environment is quite a challenging one, especially if countries are used to doing things face to face. There are a lot of challenges around sort of the relationship building, especially if you're, Dr. Mary, as you said about the different, if you're doing different levels, national and subnational, if people don't know each other or the facilitators are unfamiliar with the people that that you are participating in the interaction review. Sometimes it's difficult to bring people in and get very rich discussions, especially if you've got some people that are quieter than others. It can be quite difficult to make sure everybody is given the opportunity to participate. So some really key skills are needed by the facilitators, I would say, for a virtual delivery or a delivery over a remote platform for the IAR. Is the facilitator role is really key, and making sure that everybody understands what their responsibilities are, there to try and draw out as much discussion and useful information from the participants as possible. I think
just to add, Emily, we haven't had any country that has done purely virtual IAR. So they should note that most of them, I think almost 100%, had participants in the room and some virtual participants. Like you said, especially in Africa, if you put your entire review process virtually, you may not really with the internet connections that we have in Africa.
Yeah, and I think each different way of doing it brings its own unique challenges, doesn't it? Because it's tempting if you've got some people in one room and then others on the teleconference, then potentially the people in the room are going to have lots of discussion, useful discussion, and sometimes the people virtually are unable to jump in because you don't see those visual cues that we use quite a lot in our everyday communication or in a face-to-face environment. I think we'll move on from challenges. I think there's I think we've got time for probably one more question. So I think I'll go for the first one. So Benedict Boma wanted to ask Dr. Raymond how you aligned the IAR to Zambia's national contingency plan.
Thank you, Benedicta. So for us, when it came to aligning the interaction review to our national contingency plan, allow me just to explain how our national contingency plan works. So the national contingency plan is what every ministry will independently submit to the disaster management and mitigation unit and say, for this disaster, in this case, COVID-19, these are the activities that we would like to implement to respond as a sector. So what we did in the interaction review is sort of get those sectors before they make that submission to the national contingency plan, and work them free on the terms of budgeting and resource allocation. And once we're in agreement, we had to ensure that those priorities are embedded in the submissions they'll make as a sector independently to the disaster and mitigation unit. And because of that, once we had the interaction review done and we had the post-interaction review meeting, we invited those various line ministries to say, from the review, these are the priorities we need to have, and this is where we should put our resources in. And we ensure that those identified take-home messages and immediate actions are budgeted for and are part of the submission that they vote to make and submit to the National Contingency Plan. And by so doing, it meant that our interaction review had been aligned to the National Contingency Plan and there was no room for surprises. So just to use a crude example, the Ministry of Education may prioritize to purchase hand washing facilities for all their schools. But then the interaction review may actually bring out the fact that maybe we need to have resources around screening facilities as opposed to hand washing facilities, thermometers for screening learners as they enter, and maybe sanitizers. And once we agree in that closed door meeting that we prioritize our budgeting around those aspects, they submit those priorities independently to the National Contingency Plan. So that is how we did our alignment.
Excellent.
And, Yeah, I did note another question about advice on successful implementation of interaction recommendation. This may be different from country to country, but what worked for us is having a high level buy-in right from the word go. When we make odds, if you don't have the blessing of the policy, it's just a technical arm. The people who are ultimately have the final say are the policymakers, is just the politician, political arm of the government. And so we keep this abreast and also get that buy-in right from the start, such that when we have the recommendations coming out and we are speaking as the one of government approach. We are speaking not as just a sector of health, but we are speaking from recommendations from our colleagues from the various line ministries, and we're speaking the same language. It's easier to have a buy-in from policymakers. Thank you.
Great, thank you, Raymond. I think as well, in addition to that, we last week we did go through some sort of useful I guess, practical solutions to trying to improve senior level buy-in. So as Dr. Raymond's pointed out there, how the importance of that in delivering your interaction review. So if people are struggling with that, then maybe refer back to some of the notes from last week and this week in trying to look for some sort of practical solutions. Okay, I think that's everything for today. We have no more time for any further questions. So our next week, obviously, the series on lessons, learning lessons from public health emergencies continues. And as mentioned at the beginning, if you've not already done so, we'd really encourage you to join the PHEOC communities of practice on the Discord platform for future further engagement. This is where we post all of the presentations, and we'll also be utilizing a quiz which will be posted after the last session in the series, which is next week. So it will be a combined quiz for this series on lessons, learning lessons from public health emergencies. That will be posted onto Discord and will enable people to sort of continue their learning and serve as a knowledge check of the information presented. And this is in order to receive a certificate for this series, you must complete the quiz. So you will have seen a pop-up on your pop-up poll on your screen for you to fill in about the webinar, which I would really encourage you to complete if you haven't already done so, please. That would be great, because as I said before, your feedback is really important to us and it helps us improve these sessions in the future. So I just wanted to say a big thank you to our speakers and our panelists, some really great discussions and some questions, and some lively participation from the participants. So thank you everybody for taking part. And we look forward to everyone joining us next week for the next session in the series. And we hope you have a great morning, afternoon or evening, depending on where you are joining us from. So thank you again and see you next time.
Thank you. Bye-bye, Emily.
Bye.
Goodbye.
Bye-bye. Have a good day.
You too.